9:05. I think most, if not all of you know, I'm Carletta Crawford. I'm the Director of Nursing of our big department. I am very happy that all of you are here. I know that there's lots of things to do on a weekday, and I know some of you are coming from a night shift, and some of you have to work tonight, and you have to go home and sleep, so I appreciate any time that you guys come into the office and spend time with us, so thank you. There's tons of food. I didn't know how many people would be here, so eat and drink as much as you want. And again, thank you for coming, and please join us in our future events that we have. We love seeing you guys here. It breaks up the day and just makes it a little bit different. So thank you. But I'm going to introduce our speaker, Jessica Ogren. She's from the Alaris group, and she is an ergonomic specialist and an occupational therapist, and she's going to tell you a little more about who she is and what she does.
All right. Oh, yay, a round of applause. You don't even know if I'm going to be decent or not. So I am an occupational therapist, and right now I work as a case manager, working with people who've been injured at their job, many different types of jobs. But prior to that, I worked in a clinic where we did work rehabilitation for lots of different professions. Nursing was a big area of people that we helped because inherently it does have a lot of risk factors in it because you are handling people. And it's a lot different than handling a box. Boxes don't move, people do, and you don't know that they're gonna move with consistency. So my background is I did a lot of ergonomic presentations, a lot of job analysis, and I'm really, really excited to be here and present this information. And my goal is really that you pick up, 2 or 3 facts that you're going to remember that will make a big direct impact into your day-to-day. Probably most of you at the end of the day do feel some muscle fatigue and soreness from the amount you're transferring, or if you're more in stationary postures a lot, charting, that sort of thing. So really the goal of this is to hopefully make you feel better at the end of the day and make you realize what risk factors are present within your profession so that you can hopefully change the method in which you do things. I want to make this as interactive as possible. The first part of the presentation is going to be more lecture style, but if you have any questions or things, I would rather just share them. We don't need to wait till the end. And then towards the end of the presentation, what we decided to do earlier in the year, we got together and took some pictures of some typical transfers that you guys might do as far as getting infant or child out of a crib, transferring from wheelchair to toilet, boosting up in bed, those types of things. So we are going to go through you all probably know the right technique for the client, but a lot of you don't think about, well, what is the right technique for me? What do I want to be doing with my body to make sure that I'm having a good transfer and I'm taking care of myself. So that's really what we're going to be focusing on. We're going to go through some different common transfers that you do. My hope is that we'll kind of have a volunteer. I'll take you through the transfer, and then we'll have like 5 minutes where you can maybe pair up and practice some of these things. And not that if you're the patient, you're not going to make that person lift your full weight, but just really to kind of cement those different ideas about keeping your arms close to your body, keeping that wide base of support, keeping your abs tight. So kind of going through that whole mantra in your head so that you get a little time to practice. And then we also designed a preventative stretching program kind of specifically for nurses that we're going to take you through. I do have it broken up into slides here, but there's also a poster that you have that I'm sure will be disseminated out to you guys in whatever form that is, be it a 8.5 by 11, I'm guessing, just because you'll have those that you can travel with. And that's maybe something you can get laminated. A lot of people use alarms on their phone to try to remind them to stretch. So we'll get to all of that, but that's kind of the format that we're going to be going through today. So roughly about an hour and a half, might be a little bit less, just depending on how much time we spend in practice. So again, what are the objectives? One, we're going to talk about what a WMSD is. That stands for work-related musculoskeletal injury. And why is it important to you? Why is it vitally important that you guys really take something out of this talk? And we'll kind of go through some statistics about nursing. We decided to focus really on one body part for nursing, and that is the spine. And I'm going to be saying back a lot, but when I say back, I really mean the whole thing. So if it's upper back, if it's neck, if it's spine, disc herniations happen at all levels, muscle strains happen at all levels. So that's where we're going to focus, and not that other injuries can't happen, like shoulder injuries, knee injuries, but given our time frame, it's kind of the area that we wanted to focus in. So we will go through a little bit about anatomy, not too much, but why it's important. And then, as I said, transfers, the repositioning and boosting, crib, two-person, when to use a Hoyer, and how to get a sling under somebody if they're already in a chair, and then wheelchair repositioning. So that's what we're going to cover. So what is a work-related musculoskeletal disorder? It is a pain or disorder that can affect basically any structure in your body, from your muscle to your joints to ligaments to tendons or nerves. And it's generally the result of cumulative trauma over time. So when somebody usually has an injury in the nursing field, there's sometimes a mechanism, like I was transferring somebody and I felt pain in my low back. But sometimes it's kind of one of those issues where I drive to work and I'm kind of in this posture all day. Then I'm charting and I'm in this posture all day. Then I'm taking care of somebody and I'm in this posture all day. And so it's kind of a cycle that occurs when you're not paying attention to kind of how you want your body structure to be. And so most of the time that mechanism of injury isn't necessarily the cause of it, it's kind of that repetitive day after day after day, and finally there's an incident that causes that pain. It goes by lots of different other types of names: repetitive motion injury, repetitive trauma, cumulative trauma disorder. It's all kind of one and the same. Here is a slide that I love. It's from 2007, so it's a little bit old, but it still applies. These are kind of your different major types of occupations that you see over on the left, and the rate of incidence and the days that are lost from work from somebody who has an injury. And you can see kind of nurses, aides, and orderlies are up at that 50,000 lost work days per year. So, you guys are registered nurses, most of you, but kind of your day-to-day care of clients is really transferring them and taking care of them. So I think it's just really important to look at those statistics and know that in your field, you are going to have an increased rate of injury. It's kind of a fact. In fact, 52% of nurses generally complain of chronic back pain of some sort, whether it's chronic neck pain, chronic low back pain. And that doesn't mean that it keeps them out of work, but it means that they feel discomfort at the end of the workday, and it might not go away the next day. 12% have to leave nursing because they're not physically capable of carrying out the job demands. 20% might have to transfer to a different unit. So say you were on the ortho floor and you can no longer transfer patients, and now you're going to go into maybe it's office work, or maybe it's clinical work with a health doctor, whatever the case is. And back pain is the leading cause of disability in those under the age of 45, and that comes from the American Nursing Association. So I like to put those statistics up there because that means half of you in this room have experienced or currently are experiencing, some kind of discomfort. So I like to, when I do an ergonomic talk, the word proper body mechanics, when I say that, people generally think, okay, she's going to tell me how to lift, lift with my legs apart. But I like to think of proper body mechanics as your posture throughout everything you do in the day. It's how you drive to work in the morning. It's how you're sitting in your chairs right now. It's how you sleep at night. And there is a neutral posture for every joint in our body. We're going to be focusing on the spine, talking about anatomy and why that neutral posture is so important. But it's not only lifting, it's kind of everything that you do. So anatomy of the low back, or of the whole spine in general, you have 33 vertebrae that make up the spine. 7 of them are up here in the cervical, 12 of them are in the thoracic, and then 5 of them are down here in the lumbar area, and then the others fuse together to make that coccyx sacrum area. You can see that it provides an S-shaped curve, and why that is important is it acts as a shock absorber as we walk around and do our normal daily activities. We've probably all seen people who lose that S-shaped curve. You know, from shopping or just being around, you've seen people who kind of have a head forward position like this, or seen people that have like a kyphosis or kind of that hump in their back. All of that develops from poor posture over time in the kinds of activities that they're doing. And then in between each of the vertebrae are kind of more shock absorbers, the discs of our spine. And I like to think of a disc like a jelly donut. So for example, if I have a jelly donut in my hand and I put a lot of pressure on one side of the jelly donut, what do you think is going to happen to the jelly? It's going to squirt out, yeah. So that is really a simplistic way of talking about what happens to our body when we're in improper posture. So for example, if I come home at night and I put my feet up and I'm kind of couch like this all night long, what's happening is my vertebrae that sits on top of my disc is putting pressure on the front edge of that disc. And then let's say that, you know, I'm taking care of a client. I spend a lot of my time kind of bent over like this. Again, the same thing is happening. And then I get into bed and I curl up because I live in Minnesota and it's cold. So what's happening is I'm never getting out of that flex posture. And that constant force on that disc can cause, you know, overstretching of these muscles, over tightening of these muscles, so ending up with muscle strains and sprains, and then also disc herniations. So as I said, the muscles in the spine, a lot of us think of the multifidus and the rector spinae as kind of being our main back muscles, but all of your abdominal muscles, which run in 3 directions, you have the transverse abdominis, which goes like this, you've got your obliques, and then you've got the rectus abdominis. All of them run in different directions. They all work the best when they're contracted as you're doing your lifting. So if I spend a lot of my time in this posture, are these muscles contracting? They're like, bleh. And if I spend a lot of my time in this posture right here, they're not contracting either. So, you know, how you stand and how you, I guess, control your upper body makes these muscles have to work or not. And so when talking about different types of injuries that can happen in the neck and back, there's your basic strain, which on an MRI, you can't really see it. You might be able to see some inflammation in the muscle area. You might be able to see some tearing in the muscle, but it's when your muscle's been stretched to a point, you'll feel aching or there'll be swelling in the area, there may be redness, and the pain is generally in one specific area, meaning it's not radiating. So how I know I have a muscle strain, I'm probably going to feel real hardness and tightness back there. It's going to be, movement is going to be difficult, but the pain is going to be localized to that specific area, be it my neck or my back. Developing strains like that and having poor posture on top of it can lead to what is called chronic back pain. And that can lead to, or one of the causes of that is weak muscles in one area. So again, if I spend a lot of my time like this, these muscles back here are constantly working. These are loose and not doing anything. And if my abdominals get weak, I don't have proper support for my back for when I have to be able to lift. So you end up with a muscular imbalance, something that's stronger here and not as strong here. Muscle ischemia, I'm not using those muscles so they're not getting nutrients and oxygen and being fed to grow. And then the disc bulge or a disc herniation, and we talked about this a little bit. This is a healthy disc. That is the spinal cord. This is the spinous process, what you feel back here when you touch. And then the disc is on the other side of that. And like I said, if I'm kind of in this posture all the time, I'm placing a lot of force on the front edge of my discs. And what can happen is that jelly will squirt out the back like what you see there. Now, general signs that you have a disc herniation or that your disc is impinging on that nerve root that's coming out is you will feel radiating pain. So people who have a disc herniation in their neck may feel pain down their arm. Or it might start with a numb finger and you're thinking, okay, do I have carpal tunnel, when really it's a neck issue. So I would encourage you that in your course of your type of work, if there's ever a time where you're kind of having an incident of pain and it is going down your leg and it's been going down your leg for a couple of days, that's the kind of thing that you don't want to wait on. Because lots of times that's something that with some good therapy, and basically for a person who has a posterior disc herniation like that, what we do in therapy is to try to push that jelly back in. So it's a lot of exercises where you're doing kind of lumbar extensions, you're laying on your stomach, propping up. If you've ever had any therapy because you have a herniated disc, it involves the opposite type of motion and strengthening your abdominal muscles and strengthening your hip muscles. So there's really, you know, sometimes it's kind of hard to admit, man, I think I need to go see somebody, but lots of times it's a simple matter of, you know, just getting some therapy and learning the right ergonomics to be able to fix what you're doing. But key is, you know, listening to your body, and when you have those warning signs, kind of taking them seriously. What are the causes of low back injury? Generally, it's movement in awkward postures. So we've talked a lot about flexion, but a lot of your job too is going to involve twisting. You know, I'm picking somebody up here and I'm moving them over here. I'm picking up bags off of the floor, so I'm side bending. You know, anything that's putting your body out of that neutral position. And I'm not saying that you can't bend or you can't twist, but it's a matter of, are you doing it while you're lifting? You know, if the spine can't take that load, if you're handling a child that's 35 pounds and you're bending over at the same time. So it's a matter of kind of thinking about how you're doing things. Decrease oxygen and nutrients to the spine. So, you know, you're a smoker, you don't drink a lot of water during the day, you don't stretch, things like that. And then something that is called trigger points can also develop. I don't know if any of you guys feel up in your shoulders or in your back, and you can sometimes feel knots that develop there if you're doing a lot of like typing or sitting in one place, or you've done a lot of lifting. Those are kind of some of the things that hopefully with the stretching program that we can institute, you can notice a decrease in that. So what do you do if you have an injury? Basically, that first 48 or 20, you know, first hour to 72 hours is very key. What I recommend is always that you ice. What happens immediately when you have an injury is you've got a massive blood flow to the area, and that creates tension on your nerves, and that's what creates the pain. So you want to take away that inflammatory response, so that's why you want to use ice. If it's a low back injury, laying down in what's called that 90-90 position that you see can really help to take away your pain. And that's called if you've ever heard of RICE, that's rest, inflammation, compression, elevation. So that's kind of what you're trying to do there, compressing the spine, elevating your legs, resting. So that's the position of comfort generally. If you're having some extreme low back pain, that's the position to get in. So, you know, I have unfortunately had that pain where, you know, it's just dropped me to my knees, and getting in that position and laying there for a period of time just can allow you to kind of loosen up and relax. So that's kind of the first order of business. And then the second thing is, you know, if it hasn't went away, you're taking ibuprofen 3 times a day, and you've been dealing with this same discomfort for, you know, 3-4 days, it's definitely time to go get it looked at. Because again, it could be a matter of you only need 2-3 sessions of physical therapy and maybe, you know, a medication, versus letting it slide and wait for 3 months until you have a full-on injury that's going to require you to be out of work and that sort of thing. So improper lifting. When I lift something in the right manner, so let's say that I'm lifting this bag. And by the right manner, I mean legs apart, keeping the object close to my body, not lifting it out here. This is maybe, what, 5-6 pounds? If I'm lifting in proper technique, it's 5 or 6 pounds of pressure on my back. But let's say that I'm in a hurry, I don't have time, I'm bending over like this to the side and picking it up away from my body with that twisting motion. Anytime you do lift like that, it adds weight to your spine. So I've had people in the clinic and I'll put like a piece of paper or, maybe like a 5-pound object on the floor and I'll tell them to pick it up. And they'll bend over and pick it up like this. And I'm like, why are you doing that? We've talked about the right technique. And they're like, well, it's really light. But the answer is it's not light for your spine. Your spine is lifting your body load, period. So if I have this 6-pound object and I pick it up way out here, it's become 60 pounds of weight on my spine versus keeping it here. So you kind of keep that in mind when you're talking about patient handling. If I have a patient who's sitting here and I'm way out here and going to transfer them with my arms extended, their weight is increased considerably. So the key is, a lot of times in transfers, is just getting that weight as close as you can to your body. I love this diagram. I'm not sure how well you can see it, but it's a study that was done almost 20 years ago now, where they inserted a needle into the L5-S1 disc space and measured the pressure in different positions that occurs in your body. So if you're laying on your back, your spine does still have pressure, 25 pounds of it. If you're laying on your side, it triples to 75 pounds. So what does that tell us about how we sleep? It's best for your spine if you're sleeping on your back. Likewise, just bending over without lifting anything at all, 150 pounds of force on your back. Bending over and lifting with weight, again, that's going to be variable, but they measured it at 220. I'm not sure what the weight was. I like the slouch sitting example. Just sitting itself is 140 pounds of force. Sitting in a slouch position, 185. So, it really does matter what position your spine is in, how much force those discs are taking. And they're designed to take some, but over time, if you're repetitively lifting in that improper position, you're going to end up with an injury. So I like to talk about sitting a little bit. So you guys are all sitting in this chair right here. And really, if I force myself to use good seated posture and kind of sit back in my chair and try to keep that lumbar curve, it feels pretty awkward on my stomach. So what I want to do in this chair right now is slouch it down a little bit. So what I challenge you guys to do is take a look at your car seats at home. Take a look at what your easy chair looks like. Take a look at what your work chair looks like. And how can you set that chair up so it's not promoting you to want to slouch, especially car seats. So for me, if this was a chair I was going to sit in all the time, you can see that my back is really not supported here when I'm keeping my spine in that good neutral position. So what do I need to do? What's one thing I could do to make this chair comfortable for me? Any thoughts?
Pillow.
Yeah, exactly. So they've got those back supports that have a Velcro strap on them, and they kind of are in that, they have a flat edge and a D-shaped pillow kind of a thing. That's what I would want to do. I want to have that pillow in here, and that way I can relax into it and not have to slouch in order to have that back support. So probably the number one thing, you guys are driving, I assume, a fair amount in your work. So take a look at your car seats and figure out, do I have an inflatable lumbar support in it? Do I have that up all the way? Is it creating a good position for my spine? Because in your job, you're never going to be able to engineer out all of the bad postures, but driving is definitely one of those things you can control what posture you're in. Same thing with your chairs. And then if you're doing any amount of standing, so say you're cooking a big meal in your kitchen, and most kitchen counters are at that 40-inch height, but it does kind of make you have to bend over when you're chopping things. Simply by putting a leg up, what happens is instead of bending at my back, when I put that leg up, it allows my spine to stay in its normal curve. So just opening up your cabinet, putting your foot in it while you're cutting things will allow that bend to happen more at the hip and less at the back. So kind of the same thing, if you're doing prolonged cares on somebody who is in a bed environment, getting your leg up on that bed like this and having a hand here while you're using your arm is going to be much preferable to something like bending over and holding your trunk. So it's not that you can't bend, it's how you bend. And it's the same thing, when you're picking up a client, am I bending like this where I'm flattening out the curve? Or am I bending like this with my bottom out where the bend is happening at the hips? So that's what you got to think of. Same thing when you're going into the crib. Am I bending like this to pick somebody up where it's flattening the curve? Or am I bending like this where I can maintain the curve? And I have a stronger base of support. Just kind of a little tidbit about sleeping. We did talk a little bit earlier that sleeping on your back is better for you, with a couple of caveats. If you're one of those people who likes to have 2 or 3 pillows under your head, obviously that's not putting your neck in a good position because it's kind of forcing it in that flex position. So make sure that the pillow you have allows you to keep your ear over your shoulder if you're sleeping on your back. So is it such a big pillow that you're in this position, or is it a pillow that allows your head to be in neutral alignment? So take a look at that at home. And then if you are a side sleeper, I do recommend that you have a pillow in between your legs like that slide shows, because it allows you to keep a neutral hip position versus like this if you don't have that pillow. And then you'll get kind of that pulling on the right side of your body even though you're laying on your left. And again, making sure the pillow is not of such depth that it's putting your neck in this position. And if you're a stomach sleeper, that is actually one of the worst positions you can sleep in. It's very stressful for your back. But I know that we really can't change our sleep position. It's your thing. So if you are a stomach sleeper, I would avoid sleeping with a pillow under your head if you can, because that's going to put you in that jammed extension position. And then put that pillow underneath the bottom part of your legs. So, any questions on what we've covered so far? Hopefully, my goal for that piece of things is just that you're able to make adjustments right now when you leave here. You know, if you simply changed how you're sitting in your car and worked on how you're sleeping, that's probably 12 hours of your day right there. And it would make a huge difference. So, next we're going to move on to handling patients. And as I've talked about earlier, there are kind of some main things. All of them revolve around keeping that good posture in your spine. So let's pretend that I have a patient who's sitting right here in this chair, and I need to transfer them into their wheelchair right here. Ideally, I want to be lining things up at a 90-degree angle. So if it's the bed that they're on, and I'm transferring them to their wheelchair, or it's toilet to wheelchair, whatever the case is, you want a 90-90. Definitely don't want to line things up like this because that's just more turning of the client that I need to do. And then, I guess what I want to focus on right now is just what you want to do with your own body. So I've got somebody here. I want to keep a wide base of support. So the worst thing I want to do is keep my legs together and try to lift, because then I can't use all the muscle recruitment. I'm more likely to want to bend my back in that position with a wide base of support. So first thing, get your legs apart, at least shoulder width apart. You want to try to keep if you're working on a client who's in bed or you're doing that transfer, you want to be as close as you can to that patient. And studies show that you really can't be much closer than about 14 inches is kind of the norm. So, if you can keep your forearms next to your body, that's how you know the patient's close enough to you. So if you find yourself fully where your elbows are extended, that is not a lift you want to be doing, unless it's, picking it up from the floor. So if you have to be way out here, it's not going to be safe for you. You got to try to get closer so that those arms at least have somewhat of a bend in them. You want to keep the patient, we already talked about that. Prepare the patient for the transfer. So I'm sure that the clients you work with have a variety of levels of cognitive ability. If they do have the ability to interact with you and are kind of aware that the transfer is occurring, you want to facilitate that as much as possible. Okay, we're going to be moving you in 3 seconds. We're going to start a weight shift. So we're going to do 1, 2, 3. You're going to get your body moving, you're going to get the client moving, they're going to know when they should apply the force too. Now, if they're not cognitively there, that's kind of going to go out the window. But essentially, if they are, you want to make sure that they're ready for it just as much as you are so that they can put forth their body effort. And then the other thing is try to engage your core. So when you're going to be doing a lift, you tighten your abdominal muscles. Not so tight that you can't breathe through it and talk, but you're contracting them because that is what's supporting your spine. And then it is also important, a lot of times when somebody does a lift, if you go to the gym at all, you'll see people go, and they won't be breathing while they're doing the lift. And that's exactly the opposite of what you need. Your muscles need that oxygen and nutrients in order to work properly. So, I suggest making sure that you are forcing yourself to, regularly breathe throughout that transfer. And I know at first this is kind of a lot to think about. Your job is really to transfer the patient. But, that's why I want to try to practice some of these things in this environment so that you can kind of get used to what that feels like, that wide base of support, that keeping your arms closed. Another thing that I didn't put on there is your neck position. Because lots of times when I'm picking somebody up, where am I going to look? I'm probably going to look down at them, right? And what does that do to my neck curve? It kind of flattens it out. So when I'm actually ready to do the lift, I want to make sure that I'm looking straight ahead. And look how that even changes my low back posture. Look at this and look at that. So really focus on where is your neck position. Same thing when you're taking somebody out of a crib. Get that arm hold, get where you're going to be. You've got to look down for that part, but when you're actually doing the lift, make sure you're looking up because that does change your posture a lot. This is a very wordy slide. I don't expect you to read all of it now, nor am I going to go through it. But if you've got a copy of these handouts, I wanted you to have the information. And I do have an article here too that if I will leave with you guys, and if people want copies, they can make them for you. But it was done by a PhD, Dr. Waters, and they took what's called the NIOSH lifting equation. That's a lifting equation that's basically used for people who work in factories and things like that to determine, are we doing a safe lift repetitively for people? So they took that NIOSH lifting equation and they applied it to working with patients and doing patient handling. And basically what they found out is when you're lifting an inanimate object, you can get about 10 inches away from it, and that is a safe distance away. When you're lifting a client or a patient, it's impossible to get that close to them just because of your body mass and their body mass. So they realized that you're about 14.5 inches away. What that did to the lifting equation is that under most circumstances, when you can lift properly, the heaviest client that you want to lift manually, period, is 35 pounds of weight. So that doesn't mean that if the client is 150, but they're a mild or moderate assist, you may only be lifting 35 pounds of force. So I'm not saying that the client should only weigh 35 pounds, and if they weigh more than that, you have to do a lift. But you need to keep that number in mind, because I think a lot of times you get in environments where parents, they want to promote that independence in their kids, so they want you to manually transfer them so that they can still get that transfer skills. But in another sense, it puts you in a bad position if they really don't have the skill to help you with that transfer. You know, if they can't bear weight and they weigh more than 35 pounds, you're putting yourself at risk, straight out, period. And they're putting themselves at risk as the parent doing transfers like that too. So I think it's a really good article for people and administrators whose companies do manual handling, because basically what this article is saying is if it's more than 35 pounds of force, it's not going to be a safe lift, period. And that's if you can get in ideal positions. And that's pretty much what this says too. So I left it just because if you got copies of the slides, you'd have that information, but that's essentially what it says. So think about that. Think about that idea when you kind of look at your caseload right now. Do you think the transfer status that your clients are at is appropriate? Are you inherently putting yourself at risk and shouldn't be doing some of the transfers you're doing? Should they be Hoyer? Should they be two-person if you're in like a school environment or something? So I guess that's another tidbit I want you to take, is to analyze. And if you think you're kind of at a risky situation, you know, that's something to bring up, and that person's transfer status should probably be evaluated, because it will be a matter of time before, you know, you think they're going to give you the effort and they don't give you the effort, and then you've got a muscle strain or worse. Okay, so handling objects. Now, what you've learned, it's pretty easy. We made these pictures like night and day. Which one shows you how to properly pick up a bag off of the floor? The right one or the left? The right, yeah, exactly. So it's exaggerated, I know, but many of us, when we're in a hurry and it's just maybe a 5 or 6 pound bag, we don't think anything of it. You know, we side bend down, we grab it, and we go. And I just challenge you to really, over the next 24 to 48 hours, every time you pick up something at home and at work, think about your body position, and you will train yourself to be doing it the right way. It doesn't take any longer to do it like this and grab the handles and squat down and pick it up than what it does to side bend like this. So again, it's not the weight of the object, it's that repetitive use over time. I know you guys do a lot of things with bags too, a lot like the vents and things like that. So just really, and I know one of the concerns is how do you manage all of those bags too? Like you've got the vent, you've got that bag, you've got a wheelchair. And I don't really know the right answer to that, but I think the key is you guys probably do. You know, you have your own individual situations, and I encourage you just to think about it. Okay, so I know I got these 3 bags. What's the best way ergonomically I can do it? So that's my hope of today, is it's just raising your awareness to identify what are the problem areas, and you know, sometimes you can come up with a solution and sometimes you can't. But if you can at least help with 50% of what you're doing, you're going to really reduce your chance of having an injury. Okay, so repositioning or boosting up in bed. We kind of talked about the 1 foot forward or the knee on the bed. So let's say that I've got, do you guys do boosting up in bed with your people? And are you generally by yourself? Okay. Is there a sheet under them, like a draw sheet or something like that? You would usually use that, right? And if there isn't, you would position it. So, you know, if I was starting from scratch and somebody had moved down, you know, 10 inches in their bed and I need to get them up, hopefully you've got clearance on both sides of the bed also, because it makes it awfully difficult to boost them up if you can't move from side to side. So you're going to roll that patient over, and again, you're going to be cognizant of what your body's doing while you're rolling the client. You know, am I standing here bent over like this, pushing them, or am I getting that wide base of support, getting my arms close to me, getting 1 foot forward and making it happen like this with a weight shift versus like this with a push? So I get that person rolled over, I get this tucked in, I roll them back over, so this is under them now. The other thing that I really encourage you to think about when you're doing a boost is what position your thumbs are in. For your upper body and for your shoulders, you want what is called a thumbs up position. So with lifting, if I'm boosting, I don't want to be in this position like this with my arms away from my body. It's a lot of stress on my neck, it's a lot of stress on my rotator cuff. So many of us would grab the draw sheet like this. And what I challenge you to do is turn the draw sheet, bunch it up, and be in a thumbs up position. Because look what happened to my shoulder. It's nice and neutral, it's close to my body. Versus this, if I'm holding like this with my palms down, my arms are out, and I'm not going to be as strong that way. So bunch it up, keep your arms close to your body, and then boost by weight shifting. So 1, 2, 3, instead of with the upper body. Any other questions? Does that all make sense? Okay, so that's what you're focusing on. What I call thumbs up, wide base of support, the weight shift so that your body's prepared, and you do the 1, 2, and 3. And it's basically a step. Any other questions about bed mobility? Hopefully you learned a couple tidbits there. And again, if you're going to be working on that client, like you're doing changing, or you know you're changing tubes, whatever the case is, if it's a prolonged time period, Try to get that knee up on the bed and a hand here, because if you're bearing weight through that arm, it's less weight on your low back. Okay. And then if you are boosting them up in bed too, the only thing I forgot is, have them bend their knees and push off with their feet too, if they're cognizant and they can do that. Okay, next we go. Yeah, our model had a good face there. Caught that at a good time. Okay, so what we see in the picture, which is the bad one, first of all, the right or the left? Bad one. The right. And what makes it bad? What are the people doing in the right? Yeah. Looking down, bending your spine. Person on the left there has a very narrow base of support. So again, that lift is going to occur with her back muscles because of the position she's in. Versus the picture to the left, we see we've got the wide base of support, we've got the head in the proper position. We're as close to that patient as we possibly can be with our powerhouse, which is your abs and your buttocks. And we see that there's kind of two ways that you can do a two-person transfer. Do you guys encounter two-person transfers in your, not a whole lot? We tried to kind of make this as applicable as possible, but I'll go through the two different types because I don't know that we have another. Oh yeah, we do. Okay. So the side-to-side would be one that if you have an obstacle to doing it back to front for any reason, the side-to-side is better for you because the weight of the client is more evenly distributed. When you do a front and back transfer, which is the heaviest part of the person? The person who's in the back or the person who's in the front? Person who's in the back, exactly. And it's a significant difference. Where when you do a side-to-side transfer like this, you are handling an equal amount of weight. Any questions about that? Okay. What I'd like to do, and then the back to front transfer, and I know it seems oddly staged, but I can't tell you how many times I've seen somebody stand behind the wheelchair and pick the person up over here because they're moving over here. And we know that, you got to get behind that person and you got to take the coordinated steps to get them over. So you really, again, kind of the point of this talk is that before you do that transfer, take a beat to think about what position is my body in while I'm doing it. All right, what I'd like to do right now is break up into teams and have you guys try just a one person, like a standing pivot transfer. And to go through that technique again, you're going to take two chairs and you're going to line them up in an L shape like that. One of you will be the patient. And patients, I want you to use your full assistance because really with this practice, the whole point of it is for you to kind of focus on your own body, not to actually do the lift. So you're going to get as close as you can, and I like that 1 foot forward position. You're going to get your hands kind of on, normally if you're doing a transfer, you would hopefully be using a transfer belt, but we don't have those today. So you're going to be doing also that weight shift. Get as close as you can to that person. And you'll kind of see how that feels with your personal space. It feels awkward a little bit at first, but you kind of got to get used to that. And then you'll do your weight shifting, making sure your abs are tight. So on the count of 3, we're going to move. Are you ready? Okay. 1, 2, 3. Stand them up. Rotate. And then pay attention to how you're sitting them down too. Are you bending forward to sit them down, or are you using your legs to lower them? So let's break off, kind of separate out, get your 2 chairs lined up, and go through this for maybe 5 minutes or so. Feel free to come up front
Yeah, getting like the bended.
I was gonna say, I feel like it, yeah, it like makes me feel vulnerable. At MA's house, bending over his foot.
Oh my God. Yes.
And my back. Just like, because you can't bend your knees. We're tall.
Run into it, yeah.
No, one of my kiddos is a year and a half, and he just went to a big boy bed, like a full-size mattress bed. And we have like the gate on the side so he doesn't fall out of it. It's seriously, oh my God, like it's worse than it. Yeah. You like crawl into bed with him, and it's a super soft bed. Yeah. All right, can I practice on you? Sure. Okay, so one foot forward. And show you wide.
Yeah, like wide at the base, 1 foot kind of forward. Get as close as you can. Okay.
Okay, so we're gonna go on 3. 1, 2, 3. And then, okay.
We're taking pictures.
Not me. No.
Did you do it?
Yeah, I was just gonna say. Perfect.
I don't know if I'm right proud of that. So we're looking at you.
That's a good question.
So he was at school, he was super chill, but like he got busy, getting everything ready and stuff. Yeah. But it was funny because so like I make some with the formula, so I was really getting it better. It wasn't great, and like either way you got it, so it was fine. But it was funny.
All right, guys.
I'm like, what did I do wrong? He's like,
Everyone, we can go sit back. So, I know that it feels kind of silly doing it, but you know, I just really wanted you to get an idea of what it feels like to really make sure you're using those legs, to tighten those abs, to breathe through it. And I just encourage you on every transfer you do over the next couple of days, put a little bit more emphasis on what position your body's in so you can get that awareness and maybe make any corrections that might need to be made. Okay, so crib stuff. Lower the rails. Well, hey, I guess the rails don't lower anymore, but my child is 18, so they did it back in those days. But anyways, when you're picking any, I don't know what size of child is generally in the crib, if they might be 2 or 3 years old. You know, in general, I would assume you can be lifting somebody that might be that 35-pound mark out of a crib. And obviously, the more they can help, the better. If they're flat on their back and not able to do anything, the key is getting that wide base of support, taking that child and moving them as close to the edge as you can, so that when you do the lift, you're not lifting with your arms out away from your body. So again, if they can stand up and help you, that's going to be a lot better than if you're picking them up from a laying down position. But I'm assuming most of your clients, maybe not. Maybe you are picking them up from that laying down. So again, wide base of support. I call it sticking my bottom out so that I'm maintaining that natural lumbar curve, pulling that infant or child close, picking my head up, which is the key, and making the lift. So I think probably, you know, if you're not really focusing on it, this is more what you're doing. Looking down, getting down into that crib. And if possible, you really want to be here, let the lift happen with your legs, and then let the lift happen with your upper body for the second part of it. We pretty much covered all of that. Okay, so The other thing that I hear quite often is, well, I couldn't use a Hoyer because they didn't have a sling underneath them. It is kind of a pain to get a sling underneath a client who's already in their wheelchair, but it can be done relatively simply. Can I have a volunteer come up here and sit in the wheelchair while I get the sling under them? Any takers? Anybody, anybody? Awesome. Thank you so much. It's going to kind of get personal here.
Yep. That's
Okay, so here's how I would go about it. And hopefully this is something you encounter, and we can make this as easy as possible for you. If the client can, we're going to lean them forward as far as they can go. And this might be, if you're in the classroom, somebody else would have to hold them so they wouldn't fall out or whatever. And we're gonna say she's independent and being able to flex forward. And what I wanna do is take this Hoyer and tuck it down under her buttocks as far as I can go. And I may have to adjust by pulling this up later, but I don't wanna have not enough material to be able to pull under her. Then I can bring her back in this position. The next thing I'm gonna do is get down here into a kneel, because I don't wanna maintain this squat position for a long period of time. You can, but it makes it a little bit harder. So I get down with one knee, and I'm gonna grab that sling here, and I'm gonna lift one of her legs up, and I'm gonna give this sling a pull. And then put it down, and I'm gonna head on the other side, get down into that kneel, grab here, and she's helping quite a bit, but a leg shouldn't really be too heavy right in that position. Okay, and I gotta give it a little bit of yank, but since I tucked so much underneath there, it was pretty easy to pull. And then I'm gonna lean her forward, and I may have to pull back up on it to get it back up into position and relax. Do you guys do that already? Is that pretty much how you do things? What I want you to avoid is this, bending over and pulling, because that bend and pull motion is really, really hard on your upper body and your low back. Any questions about the Hoyer sling? I think that a lot of times we tend to take time shortcuts too. Like, it takes a little bit of time to put that sling underneath. You know, it probably took me a good maybe a minute or 2 minutes if the person's really spastic or something like that. But it's definitely worth taking that extra time to do the lift with the Hoyer versus you just saying, I'll do it manually this time. So if you do that enough, you know, something's gonna happen and you'll end up hurting the client or yourself. Thank you.
the client that I do has a huge articulating tray behind the chair with all kinds of equipment, and so we cannot do it from the back like that.
Okay.
But I do it in the way that we transferred the person from one to the next, where I'm always using the lower center of gravity, many times putting my knee in between his legs on the wheelchair, and basically the same principle of what you said, but from the front.
Yeah.
So, okay.
And there is no, I'm not here and silly enough to think that you can get in a proper body position every time. But again, my goal for you is that you're thinking about it. Before you do that transfer, you say to yourself, am I in the best position I can possibly be in? And if you really literally have to do a transfer like this, don't do it, because you will get injured after a period of time. If not that time, it's going to be the next time or the next time. So if you're in an environment where things are so tight that you can't get into the right position, then that should be a Hoyer lift if possible. You know, it's basically, the whole point is to raise your awareness. And I know that you can't get it right all the time, because, you know, I was a home health aide and a nursing assistant at a nursing home for 2 summers while I was in college. And, you know, there are just times where you got to do it in a hurry, you got to get it done. But in the times where you can, that's what you want to focus on. The last thing we have is wheelchair repositioning. So, you know, if somebody is getting real slouched down in their wheelchair, like the example you just gave, I probably couldn't get behind them to boost them up. But that's the ideal, that, you know, if they are slouching down, you're getting behind them, you're getting an arm underneath them, you're giving them a bear hug, you're making sure your legs are apart in that wide base of support, and you're sliding them up by coming to a stand. You're not sliding them up by pulling them with your arms. Because, let's face it, our legs are much stronger than our arms are. So, I guess that's our point with that. Okay. Any other questions? Have we does anybody have a transfer situation that they want to problem solve through right now that's been kind of a bugger or difficult for them at all? Awesome. That means everybody's in a good situation. Okay, so then we are going to move on to the last part of things, and that is preventative stretching. So why is it important? Why should you start doing stretches on a regular basis? Well, hopefully, you know, a lot of your job is very positional in nature. If you're caring for a client, you're, you know, bent over them. I assume you're doing a fair amount of charting or computer work sometimes also. So it's just very important that you give your body that little bit of rest and that time to get into kind of what I call the opposite position. So you'll see a lot of these stretches I designed knowing that this is kind of the position you work in a lot. So we're doing like a shoulder stretch like that. We're doing a low back extension stretch. We're doing a wrist like this, trying to kind of get you in the opposite motion that you're normally doing. So that's why we pick some of these stretches. Know that stretching should never be painful. So, for example, as we're practicing these today, if you think, man, this one really hurts, come see me afterwards, or just don't do it to the point of being painful, because that's not the objective. You should definitely do it and feel a pulling or a tightness in that area, but it should not be painful. Try to maintain a good posture while you're performing the exercises. The correct technique or the right way to do it is really important. And then also a regular breathing pattern, making sure that you're not holding your breath as you do these stretches, that you use this time to kind of just relax. And then I like a stretched hold time of about 15 seconds. And again, that's not 1, 2, 3, 4, 5, that's 1, 1,000, 2, 1,000. So it will feel like kind of a long hold time. Ideally, what I recommend for stretching is that you're stretching when you first get to the site, if possible. I don't know what your time frames are, or you know, maybe it's stretching when you get up in the morning. And then I like to have my 2 or 3 go-to stretches that I do throughout the day. I know for me, this one, I've got to do this all the time, usually when I get out of my car after I've been sitting for a period of time. So that low back extension, and this one right here is kind of one that I do throughout the day because I know I'm on a computer all day. So, you know, the whole program, if you can at least get that in once a day, whether it's before you start work, at the end of your day, in the middle of your work, whenever that is. And then try to have those couple of go-to stretches, and especially if you know you've put yourself in a risky position. Okay, I just did a transfer and I know I was bent over. You know, do that low back extension stretch just to try to rest everything. So what we are going to do now, we had a lovely model and we created this stretching program. Again, it's all on a 1-page sheet for you guys that you guys will be getting, I assume, in some form. But what I'd like to do is actually go through these stretches and do them with you all. So the first one is a neck retraction stretch. It is not pretty. It's basically taking your chin and pulling it into your head like this, so that you have double chins. No one look at each other, and here we go. Now remember, as you do this stretch, you are trying to relax, trying to breathe deep, close your eyes, and relax. Okay, the next one is a side bend stretch. So there you're just bringing your ear down toward your shoulder as far as you can. You'll feel the pull on the opposite side. And just be careful that you're kind of pulling downward on your shoulders, that you're not letting them come up, because that's going to wreck the stretch for you. Okay, and then we're going to move to the other side. And relax. Okay, Next is that stretch for the upper back. You're going to clasp your hands in front of you like this, and you want to reach forward and try to really pull those shoulder blades apart. All the while breathing nice and deeply, relaxing. Okay, and then if you're sitting, what you can do for this one is grab the back of your chair and just push your chest forward. If you want to stand and do it like the picture shows, you're just clasping your hands behind you, pulling your shoulders back and lifting. And relax. Okay, moving along to some wrist stretches. This one you want to place your palms together and you're just going to push downward as far as you can. If your palms start to separate, that's enough of a stretch and you'll hold it there. And you should feel this on the underside of your wrists. And relax. And then the next one, this is kind of an exception to that 15-second hold. What I want you to do is just spread your fingers as wide as you can. Hold that for 5 seconds. Relax, move them around, spread them and hold. Relax, move them around, and spread them and hold. And relax. Okay. Then we're going to get the lower body. This is another exception to the 15-second hold. If I told you guys to hold this for 15 seconds, we'd be falling over, it would hurt. Don't do that. So generally, let's all go ahead and stand up. Get your legs apart in a wide base of support. You want to take your hands, and you know you've got your sacrum back here, the top of your hip bones. Place the palm of your hands right on those hip bones and just kind of gently push back. We're going to hold for a couple of seconds and we're going to come forward. So don't hold that one for a long time. But I do like to go ahead and repeat this a couple of times. And one more time. And relax. Okay, next one's a quad stretch. Definitely hold on to something. We don't need anyone getting hurt in the ergonomics class. So the table, a chair, whatever, you're going to grab a leg and you're just going to pull it if you can to where your heel touches your buttocks. Now, if you have any knee problems, some people are not even going to be able to get close to that. But the point is to feel that stretch in your quad. And for some of you, this stretch may not be enough. Then you can pull back on it a little bit and you're going to feel it more. Okay, and then we're going to switch to the other side. And relax. Okay, the last one is a stretch for the hamstrings. Now there's many different ways you can do this stretch. You can do it with your foot up on a chair if you want to and feel it that way. I just don't like to do that in ergonomic class just because there's not usually a lot of room. So for this stretch, if you want to take your right leg and put it out in front of you, keep your weight on your left leg, keep your toe of the right leg facing toward you and just sit down into the stretch. Does everybody feel that in their right hamstring? Okay. So again, if you've got a chair and you want to put your foot up on a chair, that's fine too. And relax another side. And you guys go ahead and do this one. If you do put your foot up on a chair, just make sure that you're not doing this and flattening out that curve, that you keep that back nice and kind of keep that normal curve you would have. And relax. All right, so after we've went through those stretches, like how do you feel? Does your body feel a little more alive? Do you feel a little more loose? And you know, if you really incorporate these and kind of do them regularly throughout the day, I guarantee you, you will have less musculoskeletal pain at the end of the day. So, you know, if you want to put an alarm on your phone and it goes off every 2 hours to do a couple of these stretches, you know, that would be a great idea. And then you guys can go ahead and sit down. I just have, I think, one more slide. Okay, so the last thing that I wanted to talk about is with the type of work that you do, you can develop a lot of muscle knots at the end of the day. So those knots that are up here in your shoulders, in your neck, in your spine, back in here. And basically why those develop is it's a buildup of lactic acid from, you know, even somebody who works at a computer all day develops those knots up in here because those muscles are constantly tense. So, and basically what that can produce, you know, when you get that knot in there, it can compress on nerves and create a lot of discomfort, pain, and tightness. Stretching is one way to get rid of it. I think the best thing out there is called a TheraPain. I don't know if you guys have ever seen these before. You can Google them. You can get one for like probably $20, $25. They sell them at a few stores, like there's called this Relax the Back store, and Edina has them. They have them at physical therapy places. But I think it's a godsend for anybody, you know, one, if you're doing a lot of computer work throughout the day, or two, a lot of lifting and handling, and you carry your stress up in this area. It has a knob that you can see kind of right there, and you can do lots of things with it, like the picture shows her kind of digging into a trigger point that's back in here. So it's like a tool that allows you to get a back rub without having to go and get a massage for $90. But I like to use it up in here, so I take that knob on the top, put it there, and kind of give it some push and pressure into those muscles. Another thing that works really well is a golf ball. If you've got a golf ball at home and you've got a lot of tightness up in here, leaning against it on a wall or laying on it, buttocks and leg tightness, a tennis ball also works. So I would encourage you to kind of find some way to get rid of those muscle knots in addition to the stretching. Oh, you got one, yeah. Yeah.
Do you want a demonstration?
I do want to demonstrate.
Because it looks really fun where we could hurt ourselves.
Okay, so lots of ways you can use it. Say if you carry your tightness in your low back, you take the knob here, you put it in and you give it a push, you apply pressure. And it doesn't hurt me at all to do this because I can be in a neutral position versus me pushing into that and rubbing it back here. So it allows you to kind of put that force into it. And what that pressure does is it increases the circulation so that you know, you can get the blood moving in there, and it moves the lactic acid out of the area and takes away the trigger point. So it's not meant to be used like this. It's meant to be over that area, put some pressure into it, breathe through it and relax. It may not be comfortable in a lot of cases. You might feel, oh my gosh, I feel a little shooting pain. It's especially great for if you have that tightness in the shoulder area, so you take that knob and you place it kind of right in there, and you can see I've got a trigger point because that's what it's moving over. But you just push into it with the pressure that you can handle. Relax into it and then move it up to the next area. You can use it in your neck also, like placing it here and kind of giving a pull for those muscles. I do want you guys to try this. I just want to pass it around, try it for a couple of minutes. Basically I use it until that muscle relaxes. And you know, it can take a good 30 seconds, release it, do it again, but you'll notice a major difference. Like it's a godsend to have. I like to, I don't have one in my car right now, but I have it in my office, and of course I didn't bring it today, but. Does anybody have any questions right now on what we've covered? Okay. Well, I don't have any other content for you at this time, and again, my hope is that you institute some form of stretching and just go back and look at your caseload, think about, is there any situations where I'm putting myself at risk, and how do we go about getting rid of that risk? And then what's the body position that my body can be in all the transfers I do, how I sit, how I sleep, how I stand. So hopefully you've learned some good practical techniques that you can institute. So if you don't have any more questions, I think we're pretty much wrapped up then.